The innovation that I'd like to share with you is the idea that in order to improve patient experiences, we need to think about it as an exercise in reducing patient suffering. Have you ever been to the doctor or the emergency department or even the hospital, and afterwards you got a survey? It might have been in a letter or a phone call or even an email, and it asks you about the care you received. Well, each year we receive surveys from more than 27.5 million patients across the country. That's more than 1 in every 5 households who provide feedback about their care. Now, I'm not a doctor or a nurse, but I am very familiar with the healthcare environment. For the last 20 years, I've been involved in health services research, and most of my work has been with patient experience surveys. Because of my work, I'm used to thinking about healthcare from the patient's point of view. And I'm also used to people questioning whether or not patient experience data or what people say on those surveys should actually count as a quality measure. Now, 30 years ago, when we introduced patient surveys, we talked about patient satisfaction. Is the patient satisfied with the care they received? And back then, the focus wasn't just on figuring out ways to improve care. It was also focused on reducing risk, because a more satisfied patient is less likely to sue you for malpractice. Even today, doctors and nurses can feel under pressure to get their satisfaction scores up, in addition to providing high-quality care. But the truth is that even when we were calling them patient satisfaction surveys, we were asking patients to evaluate their care. The surveys ask about some pretty important issues, like pain control, information, empathy, choice. These things are part of high-quality care. And improving patient experience can't just be about reducing risk. It has to be about something that's more tied to the mission of healthcare. So several years ago, I created a model that's now being used to transform how we think about and use patient experience data. And that's a model that reframes effort to improve patient experience in terms of reducing patient suffering. Now, using the word suffering, it might sound like I'm being overly emotional about a survey process, but do you know what the word patient actually means? It comes from a Latin root that means one who suffers, or I am suffering. So to say that we're working to reduce patient suffering really just means that we're remembering who we're caring for. Now, to dig into this idea a little bit more, I'd like to introduce you to my daughter, Charlotte. And she's pretty terrific. But about 2 years ago, she started complaining that her wrist hurt. It was worse in the morning, right when she needed to get ready for school. And then it would always act up again at night, right when she was supposed to be doing homework. So we told her it was probably carpal tunnel syndrome and said she was spending too much time on her iPad. And then one morning she hobbled down the stairs, gripping the banister, and said, "Can you have carpal tunnel in your feet and ankles too?" We hoped it would get better, but it got worse, and she became more and more uncomfortable. She missed some school. Some days she couldn't get up out of a chair or walk by herself, and some nights we had to carry her upstairs to bed. 2 months later, a pediatric rheumatologist diagnosed her with juvenile idiopathic arthritis in more than 20 of her joints. Now, I don't like to keep people in suspense, so I'm going to give you the happy ending first. Charlotte is doing great. She plays sports, she argues with her brother, she gives me fashion advice. But for today, her story is going to serve as an example to talk about what it would mean to set reducing patient suffering as one of the goals of healthcare. First, we have to think about the fact that there is inherent suffering that comes from disease. This suffering is created by your illness, symptoms, limitations, but also fears and anxieties. So for Charlotte, her symptoms of arthritis started small, but they grew over time. So morning stiffness became full days of aches and pain and exhaustion. She was late or absent to school a lot because some days it was hard to get out of bed. She had to quit dance lessons. And our days were filled with uncertainty because we were trying to figure out when to be patient, when to call a doctor, when to become demanding. And life became terribly unpredictable because she'd seem fine. And then something would set her off and she'd be in pain everywhere. One night I was helping her to stand up and she looked at me and said, "Am I disabled?" And I said, "No." But I really hoped that I wasn't lying to her. All of this was suffering related to her disease. It hurt her. It reduced her quality of life, and it scared all of us. Now, even if care is perfect, there's also suffering that comes from receiving appropriate treatment for your condition. So for arthritis, first it started with lots of blood draws and tests, some of which were scary or even embarrassing. And you start treating joint pain with things like Advil and Aleve, but you have to give doses that are much higher than you'd normally give a 10-year-old, and it tore her stomach apart. So she'd wake up in the middle of the night screaming in pain, and we'd go in to comfort her, but nothing seemed to work. Another part of treatment is wait, and this is appropriate wait. So you wait to see if joint pain will get better on its own. You wait to see if it's time to see a pediatric rheumatologist. You wait to see which type of medication will work and which doesn't before you graduate to the next type that hopefully will. All of this is appropriate waiting, but it's filled with hurt and worry. And waiting can be the hardest work of all. In the middle of one of those awful nights, Charlotte said, "I feel like I'm frozen in a cage of pain." And one small part of my brain thought, that's a really impressive metaphor for a 10-year-old. But the rest of my brain thought, that's my 10-year-old. And the burden of responsibility became overwhelming because I was focused on each next step and what we needed to do to get it fixed. And I frequently found myself saying, don't worry, tomorrow we're going to try fill in the blank, and I promise you that we will figure this out. And that became terrifying because I was not figuring it out. And so something switched, and I heard myself say, don't worry, the doctors are going to figure this out. And she noticed immediately. She said, but you always told me if anything ever tried to hurt me, you'd kick its butt. And she had just realized that I couldn't live up to that promise. Feeling powerless is one of the ways that families suffer too. To improve patient experience, we have to start by acknowledging this suffering and then understand what patients need. In the beginning, patients need a skilled clinician to diagnose and treat their issue. They need their symptoms managed, especially if pain is one of them. They need information about what's wrong and what's going to happen. And they need empathy to help them cope. And then once treatment starts, then they need more information about what comes next and how to navigate. Patients and their families need empathy about how frightening and disruptive it is to have a health issue. They need you to preserve as much dignity and respect as possible. And they need to be involved in decisions so that they can have some control over what's going on. For the inherent elements of suffering, our goal should be to reduce this suffering. We might not ever be able to make it all go away, but our goal should be to make things as good as they can be given the circumstances. Now, the last kind of suffering I want to talk about doesn't come from the disease or the necessary parts of treatment. It comes from the dysfunction in healthcare. So in addition to the big things like medical errors or misdiagnoses, this is lack of respect or unnecessary waits or conflicting information, processes that can make it harder to be a patient than it needs to be. Now, mostly our care went really well, but you don't find pediatric rheumatologists everywhere, so our appointments were 2 hours away. That's a full day for a parent not to go to work and a kid not to go to school. And we had some miscommunication when we were first getting our referral. Our primary care doctor called in a favor, and a pediatric rheumatologist offered to see us on her lunch hour so that we could have an appointment within 2 weeks. But scheduling didn't get that message. Nobody called us with our confirmation. And when we called them, they offered us a first available 3 months away. It took several more weeks and another miss at scheduling before we had our appointment. And those weeks were weeks that we didn't have a diagnosis, weeks we couldn't start the first type of medication that would in fact fail, and weeks waiting to start the second kind of medication that would finally get her out of pain. And lots of people wait longer than we did. For avoidable suffering, often these are things that patients don't even think about until their needs go unmet. It's when you don't experience courtesy and respect that there's a blow to your trust. It's unnecessary wait that makes you feel a sense of urgency and helplessness. When there's conflicting information, you feel like there's not teamwork here and I'm not sure that I'm actually safe. And if something goes wrong and nobody acknowledges or apologizes for that, that's when you feel unheard and unimportant. For avoidable suffering, our goal needs to be different. Our goal should be to prevent the avoidable suffering. If our goal is patient-centered care, we don't have the right to make things worse for patients. Understanding and meeting patient needs. This is the patient experience. This is quality from the patient's point of view, and only patients and their families can make these judgments. This is what it takes to reduce suffering. And it's a lot to get right. It can feel overwhelming to clinicians to set reducing suffering as the goal. But the good news is we know that there are a few key issues that if you get really right, it makes a huge difference for patients. When we look at national data for patient experience, we often use likelihood to recommend as an outcome measure, because if you trust the care you received, you would recommend it to others. It's an indication of trust. And based on national data, we know that there are a few elements of care that can dramatically increase or erode that trust. So if all of you here had had a child in the hospital, and I asked you how likely you would be to recommend that hospital to others, based on national data, I can tell you that 79% of you would say your likelihood to recommend was very good. But I can also tell you the single most important element of care that would divide this room into high recommenders and low recommenders, and it's whether or not you think the staff work together to care for your child. If you over here felt like staff working together, teamwork was optimal, your likelihood to recommend goes up to 96%. But if you wouldn't give staff working together the highest grade, your likelihood to recommend goes down to 33%. Teamwork is the most important thing that would place you into one of these two groups. After teamwork, the next most important thing is the trust that you have in your child's physician. Over here, you guys were feeling positive, you experienced great teamwork, and some of you also completely trust your child's physician. Your likelihood to recommend inches up to 97%. But those who felt teamwork was optimal, but not so sure you trust your child's doctor, your likelihood to recommend goes down to 84%. On this side, this was the less optimistic side. You didn't experience great teamwork, but some of you do completely trust your child's physician. Your likelihood to recommend is at 52%. But those who first I told you you didn't experience teamwork and now you're not sure you trust your child's doctor, only 23% of you would recommend the hospital. After teamwork and trust, the next most important issues are things like courtesy and respect and responsiveness to concerns. But notice what doesn't make the top three. There's nothing here about convenience or hotel-like amenities or satisfaction. And we see the same patterns when we're looking at adults in the hospital or people visiting their doctor or going to the emergency department. What matters most is teamwork, trust, and compassion. Our system has become so highly complex that teamwork is absolutely essential. One clinician can't do it alone. Teamwork is what conveys to patients that they're in good hands and the right things are going to happen and that they won't slip through the cracks. It takes some of the burden of work off of being a patient or the parent of a sick child. When my husband first took Charlotte to see her rheumatologist, Dr. Kathleen O'Neill immediately made them feel safe. She listened to the history of symptoms, she explained what had shown up in blood tests, and she did a full physical exam. Charlotte thought she was a mind reader because she could feel a joint and say, ooh, that one really hurts. Well, now this one doesn't hurt as much, does it? Well, that one's not bad, right? Charlotte thought it was a game. And when she finished, she first turned to my daughter and she said, Charlotte, the first thing I need to say to you is that I believe you and your pain is real, but we're going to work on fixing that. And then she turned to my husband and said, now the thing I need to say to you is that it is now my job to figure this out. She showed empathy, she inspired confidence, and she claimed responsibility for helping my child. Dr. O'Neill was the captain of our team, and our team did not let us down. She reduced our suffering in the first half hour that we knew her. When we work to reduce patient suffering, we are not just making people happy or creating loyal customers or getting our scores up. We are truly putting patients at the center of care. Suffering is personal, and responding to it connects those who provide care with the unique individuals they care for. Working to reduce patient suffering puts a face on patient-centeredness. Thank you.